pre-installation CME. This CME will be on two parts. The first part will be, the topic will be gender neutral HPV vaccine, and the talk is going to be delivered by none other than our vaccine expert Dr. Sanjay Marathe sir. Welcome sir.
Good morning everybody on this romantic Sunday and a promise day. So at the end of this talk, I am going to take a promise from you that whenever you get an opportunity, you will give vaccine to an adolescent girl or a boy, which is not only recommended by all authorities in the world, but it is our responsibility, and it has been proved beyond doubts that HPV vaccine protects you against so many cancers in females as well as in males. And all these recommendations are not because some company is sponsoring. This is evidence based, and across the world this vaccine has been given. So let us see. I have slightly changed the topic of this today's talk. Instead of just on a gender neutral vaccine, on this installation ceremony of the Adolescent Academy, I thought the topic should be catch them young. Why? And a gender neutral vaccine. So let me first start with the heartiest congratulations to Dr. Nilesh and Dinesh. Greetings from our Colors Hospital, Mother and a Child Care. With the change of the topic, catch them young and gender neutral too. HPV vaccine. Friends, there are only two adolescent vaccines which are purely adolescent vaccines. One is Tdap and second is HPV. The HPV vaccine is highly recommended but somehow neglected. Recommended by whom? All the authorities in the world. Whether it is WHO, whether it is European Medical Academy, whether it is ACIP, that is CDC, whether it is our own ACVIP or a FOXI. So everybody has strongly recommended this vaccine, but neglected by all of us. Doctors have neglected it, the community has neglected it, the politicians have neglected it, and thankfully to this government, in this budget session, our minister has said that we are going to give a special grant for this HPV vaccine to be introduced in a national immunization program, and we must congratulate this minister for taking such an important initiative, and it is going to be a game changer. And even the WHO has said the HPV vaccine in the national immunization program is going to be a game changer. This is so important for all of us. This picture is looking very scary, and the same is with the HPV disease and the consequences. Why I am saying so? Initially the HPV was associated with cervical cancer, cervical cancer, cervical cancer. But do not limit yourself to your cervical cancer. There are so many precancerous lesions, cancers and genital warts, which are always almost 100% associated with HPV infection. So if you get any of this condition, the precipitating factor is an HPV disease or HPV infection, and therefore do not limit yourself to cervical cancer only. So it is associated with vaginal cancer, vulval cancer, anal cancer, penile cancer, oropharyngeal cancers, and the genital warts to the extent of 100%. Such a great association, for the first time that any viral infection has got association confirmed for the malignancy. Because we will say, moms, you can give to some kind of lymphoma, something like that. But this is the virus which has been established having association with so many cancers in the body, whether it is a boy or a girl. So therefore it is very important. What are the different cancers? 100% association with cervical cancer, nearly 100% with anal cancers, 100% with genital warts, and variable extent of 70 to 80% with the other cancers of anogenital region. Therefore, it is extremely important for us to prevent this infection. because these are all vaccine preventable situations and therefore we must know. Are you not scared? In the world, 6 lakhs cases per year, then 3.4 lakhs deaths per year in the world, and we are contributing 20% of this. And where the deaths are occurring? Most of the deaths are occurring in the lower and middle income groups in Asia and African countries, and we are part to that. Because the Western world has started giving HPV vaccine, their incidence has gone down like anything. So they are protecting their population, and we must start doing it. And government has already taken the initiative. So the picture is very scary. Is it different in our country? No. 51 crore women, they are having HPV infection or at a risk of cervical cancer, which is almost to the tune of 17% of the world. 1.25 lakhs cases added every year, that is contributing 21% to the global population cases of the cervical cancer, and annual death rate 77. I think it is under-reporting most probably, because in our country where is the reporting of only those cases who are coming to medical colleges or in the private sectors. So every year India is adding 70,000 deaths only because of the cervical cancer, forget about the other cancers. I think this is the same. This is just to tell you that any point of time 6.6% of the women in our country, they are carrying HPV virus in their anogenital tract. Then genital warts. Do you think that the incidence of the genital wart is very uncommon? In the females, you can see the red line. Up to 40-45 years, the genital warts are quite common. Then the incidence goes down. In males, throughout their life, from 15 years to 70 years, they are at a risk of getting genital warts because of the HPV strains 6 and 11 and others. So the boys are always at a risk of getting HPV infection even in the later age of their life, and at a risk of developing malignancy after 20 years of that. So this is a disadvantage for a male as against the women. Now let us see what is the HPV. The most common sexually transmitted disease, this is one. 90% of the infected population eventually clear the infection. This is a good part of HPV. So 5% will have a persistent HPV, and they are likely to go for some changes called as CIN, CIN2, CIN3, that is cervical intraepithelial neoplasia. Same with the vulval or vaginal. Just we are taking an example. So only 5% will go for these dysplastic changes. Good part is that still CIN2 and CIN3 can revert back to normal, and very few patients from CIN3 will have the malignancy in that particular region. But that number is huge, because every male and a female in their active sexual life, they are going to get an HPV disease. So nobody is spared. Now we always talk about the high risk and the low risk HPV. If you talk about the high risk, we all must remember 16 and 18, but do not limit yourself to these two. There are few more: 31, 33, 35, 45, 52, 58, 59, 61 doubtful. So on an average, there are about 12 oncogenic serotypes which can cause malignancy, same as 16 and 18. But predominantly 80% of the time it is 16 and 18. What about the genital warts? A non-oncogenic strains, out of 200 HPV serotypes, there are about 20. And association of 6 and 11 is to the tune of 100%. So 6 and 11, they are responsible for genital warts to the extent of 100%. But they have isolated 16, 18, 31, 33 also in the genital warts, saying that the person who is exposed to 6 and 11, or you are seeing the genital warts, though genital wart itself is a non-oncogenic disease, there is a potential to turn into malignancy in few patients if it is caused by the other HPV serotypes like 31, 33 or 16 and 18. So every genital wart should be monitored carefully for any malignant change. This is a take-home message for all of us. though genital wart per se is a benign condition. This is the global burden which we have already seen, so we will not repeat it again. Anogenital warts, I have said 6 and 11 responsible for 90 to 100% of the cases. Friends, is it not disturbing? Suppose you make a diagnosis of genital warts in an adolescent girl or a boy. It is definitely, because within 3 years of HPV infection you can get a genital. And it is very depressing for that girl or a boy. There is always a risk that he has been exposed or she has been exposed to HPV infection. You never know. This time it is genital warts. Might be he or she has been exposed to 16 and 18 also. So it has got a big psychological impact. If you make a diagnosis of cervical cancer or the dysplastic changes in the pap smear, the whole family is disturbed, and you always think of the worst consequences of these dysplastic changes in future. So to avoid all these things, if you can give a vaccine, all such things can be prevented right in the beginning. So prevent HPV infection. A bit about the viruses. Why it is important? It's a DNS virus, that is one, having a capsid with 2 important antigen, L1 and L2. Why L1 is important? Because it's a major antigen. All the vaccines are prepared from this L1 antigen. L2 is a minor antigen. So for us, it's a DNA vaccine, a DNA virus. Secondly, it is made, all the vaccines are made up of L1 antigen, which is a most important and a prominent antigen of this HPV vaccine. The significance I will tell you. If you see the course of the disease, all the patients are asymptomatic. So you cannot make a diagnosis of HPV infection in a male or a female. It takes such a long time that incubation period could be 6 months to 8 months. For immune response, it takes about 9 months to 12 months. Then seroconversion. This is another very important aspect. Seroconversion is seen in 60% of the females and only 20% in males. That means our immune system is never challenged with this HPV virus, and there is no good robust immunity against this HPV. Why it is important? Because whatever immune responses are seen in females, they all mostly are non-neutralizing type of antibodies. Means they are not protecting that female again against the same serotype. So most of the antibodies are non-neutralizing, not useful to that person. In boys it is just 20%. This is another risk factor where if the boy gets an infection with the HPV 16, he can get n number of recurrent HPV 16 infection because there is no protection offered by the immune system because of 2 things which we will discuss. So natural infection does not give you any protection lifelong or immediate also. But 90% or 95% of the HPV infections are cleared by the body, so that is a good part of the HPV. This is all we were discussing. We will not go into the details. As we will say, CIN 2 or 3 can only go for a cervical cancer, but most of the conditions may revert back to normalcy and clear the HPV infection. Another important thing which we should always remember. Most common sexually transmitted infection. Every sexually active man and a woman is going to get HPV infection. Younger the age, exposure to HPV, higher risk of developing HPV infection, persistent infection and the disease. I will show you the study. Most common way of transmission is through the active intercourse and transmission through vaginal infection or the anal infection. But can be transmitted, this is the most important thing, can be transmitted by the intimate skin to skin contact. So condoms will never give you 100% protection against HPV, and those adolescents involved in the initial close intimacy still can get an HPV infection before they enter themselves into the active intercourse. So HPV infection is very common in adolescents because of this way of transmission. Always remember. There are no signs and symptoms of HPV infection, so it is impossible to make a diagnosis unless you are doing a test and a DNA study from the cervical epithelium. This we have already discussed. Low risk are 6 and 11, but others are 42, 43, 44. In high risk, the most common are 16 and 18, but always remember the remaining, because now we have got a new vaccine which has got a 9 serotypes. Now, this is the take-home message for all of us. This is the most important transfusion of the disease. Why the adolescent is a vulnerable age? I will give the explanation for this. Why we should protect them before they are exposed. Now, if you study the anatomy, you know there are two types of cells, squamous and columnar. And there is a junctional zone where the columnar epithelium is going to be converted into a squamous. And this transitional zone is at risk of developing HPV infection. And this is the area in almost all the females you will see dysplastic changes taking place, and therefore this transition zone is being developed during the adolescent age. If the adolescent gets the infection during this period, there are more chances of dysplastic changes in this area. Therefore, the adolescent is at a vulnerable age, sick. This is called as the transformation zone. Another thing which is very important is immune evasion. Means what? Even if there is an infection, the immune system is not challenged. Because two things. I said it's a DNA virus. So DNA virus has a capacity to suppress immunity. One. Secondly, the virus remains intraepithelial. So it is inside the cell, multiplying, never getting exposed to the immune system which is outside the cell, and therefore the disease remains for months without giving a robust immune response, and this is called as the immune evasion. So minimal viral exposure to immune defenses, there are no pro-inflammatory cytokines to give more and more immune antibodies to be formed, and whatever antibodies are formed, they are non-functional or non-neutralizing. So practically speaking, body does not give you any protection after the HPV infection. So why immunize pre-adolescents? Prophylactic vaccine. Vaccine is never to be given for treatment, it is always to prevent. Sexual exposure is unlikely between this age group, so protect them immediately. Then you have a chance, because at 10 years you give Tdap, you also introduce HPV vaccine at the same time, so your coverage goes up. Immune response is better in younger age group, that has been demonstrated by this slide. If you see the age wise, maximum antibodies are seen in the age group of 9 to 13 as compared to others. So this is the period where the individual is immunocompetent and the immune responses are best. So protect the individual between this age group to get the maximum benefits. This is another study which says the boys and the girls between the age group of 9 to 15, if they are compared with the age group of 15 to 26 of females, the antibody titers are much above. So if you are protecting a woman after say 18-20 years, the antibody titers might be less. If unfortunately she is already exposed to the HPV infection before, the protection will not be given to that HPV serotype for which she has been exposed. So she will get the less advantage as compared to an adolescent boy or a girl who gets a vaccine between 9 to 14 years. And therefore we must carry them here. Mechanism of protection, two types, exudation and transudation. When I give the vaccine, abundant number of antibodies are there in my body, and few are coming out of the vessels, and on the cervical epithelium and vulvar epithelium you can see the antibodies already present, which will initially prevent the HPV. Whenever there is a damage to the base membrane, from the vessels n number of antibodies will come into the picture, and they will block this HPV virus and will not allow this HPV virus to attack your lining epithelium. And that is the point. Once it goes inside the cell, you cannot protect it. So you have to protect HPV infection before it enters into the cell. And that is the role of transudation and exudation of the antibodies in your HPV vaccine. This is the same. This is another study which was done in the boys as well as the girls. Even at the end of 18 months, now this study has been continued for 14 years, and they have demonstrated in the same group for 14 years not a single case of HPV related either a cervical cancer or any other cancer, of the vaccine strains, not of all HPV, but they have given a quadrivalent, that is 16 and 18. So even after 14 years of Gardasil 4, there is not a single case of HPV related to 16 and 18 or not a genital warts. So that shows the efficacy. Efficacy for 14 years is a very long term efficacy for any vaccine. This is another unfortunate part. Exposure to HPV at a young age increases the risk of cervical lesions and cancer in women. They have seen if the exposure is before 17 years, the incidence is very high of HPV infection and a disease. As the age of exposure goes up and up, the chances are less. So therefore they say always immunize the adolescent because they will be involved in the other activities and all that because of the changes in your lifestyle. So protect them before they get the HPV infection. Earlier the exposure, 5 times more risk of getting the HPV persistent infection and a malignancy. How the HPV vaccine is prepared? As I said, L1 antigen, they isolate the L1 antigen and it's a DNA recombinant technique. They take this L1 antigen from the virus, purify it, then they take Xerox copies of this L1. So it is very safe. After giving an HPV vaccine, somebody says, can my daughter get an HPV disease? You said absolutely no chance because there is no live virus. So it's a DNA recombinant technique where only the L1 antigen, like a subunit vaccine in our flu and all that, then they will prepare a vaccine and only L1 antigen is given to that individual of that serotype. So it's absolutely safe vaccine. Anti-vaccine people will always tell you all these things. Now this is the slide you all should remember. What is the schedule recommended? Now I will say there are 4 types of vaccine. We will not talk about the cervarix because it is no more available. Now the vaccines which are available to us, there are 3 vaccines available. One is Gardasil 4, Gardasil 9 and Cervavac 4. So 2 are quadrivalent, 1 is nanovalent. So Gardasil 4 is only recommended in females in India. Though internationally it is recommended for boys as well as girls, only recommended in India is Gardasil for females. That should be very clear. Gardasil 9 is recommended for boys as well as girls in our country. Age group 9 to 14 for boys only. And for girls 9 to 26 can be extended up to 45 after communicating with the family. Cervavac, introduced by our own Serum Institute, got license of a gender neutral vaccine, which is a quadrivalent vaccine having 16, 18, 6 and 11. Can be given in boys as well as girls from the age group of 9 to 26 in boys as well as girls. Now there is no confusion. ACVIP in recent recommendation has said only 2 doses are required of the vaccine between 9 to 14 and 3 doses after 15 years of age. In an immunocompromised individual, irrespective of the age, you should give 3 doses. So there is no confusion and now you can start giving 2 doses officially. You can say CVAP has come. So I think this is the most important slide for all of us. Some anti-cancers people are against this HPV vaccine, especially we will see in Japan and all that. In 2013 in Japan, disproportionately given importance to the side effects which were never proved because of the HPV. Government has to stop HPV vaccination in Japan for 10 years. Now in 2022 they have restarted HPV vaccination in Japan and WHO has said because they have not given the vaccine in 10 years, Japan has got 25,000 cases of cervical cancer and 6,000 deaths. And now the government has realized their mistake and now it is recommending HPV vaccine also in Japan. 75 countries have given permission for gender neutral vaccine, so should be given to everybody. 5 reasons one by one why the adolescent should be protected. When you ask to start driving, you ask them to wear the seat belt. So HPV vaccine is safe. You use HPV vaccine before they are exposed to this. So So it is always for prevention, not for the disease. This slide we have already seen. The antibody responses are excellent in this age group, so you should always give it. Efficacy has been proved for 14 years, which is a very long term, and on a mathematical calculation, it is almost for the tune of 40 to 50 years. Cervical cancer protection is almost 100%. Vaginal vulvar cancer protection against the serotypes is almost 100%. This is very interesting. High risk acquiring HPV even with the first male partner. So HPV does not require multiple partners. So even if with the single partner, 31% will be having HPV infection by the end of first year and 50% positive by 3 years. So practically speaking, everybody will get an HPV infection, those who are involved in the actively sexual. And as far as the finances are concerned, you can give only just 2 doses, which are as good as the 3 doses in the adolescent age group of 9 to 14. So try financially also, this is good for the families to give only 2 doses. So these are the 5 important reasons why you should give HPV vaccine in the adolescent age, and therefore the part 1 is catch them young is concluded. Part 2 in 5 minutes. Do I have 5 minutes now? Okay. The most important, why we should have a gender neutral vaccine. This is the ad which I remember. They should say why only boys should have all the fun. So similarly I thought, why only the girls should be protected and not boys? Because the girls are getting infection through boys only. There is no third way of getting the infection. So if you protect a boy, you are indirectly protecting a girl. And if you are not protecting the boys, you are protecting only 50% of the population, and 50% will continue to have infection. So boys should also be given the same vaccine. There are good number of cases, though not as common as anogenital malignancies of the female, but the boys are at risk of getting genital warts throughout their age. Very high incidence of anal and penile cancers associated with the HPV, and you will be surprised to know this is the HIM study. HIM study says that is the HPV in males. This study says throughout the age from 18 years to 70 years, a male is at a risk of getting HPV infection, not like a female. The prevalence goes down after 45 years of age. This is one risk factor. Secondly, this is the same. The transmission to the girl to the boy is more in HPV as compared to the boy to the girl. So it is the other way. So he is always at a risk of receiving HPV infection to the girl. This is second important thing. This is the most important slide. The immune responses in a male is so poor that seroconversion is just 20%. So if the chances of getting recurrent HPV infection or a reactivation of the same HPV is so common in boys that they say the risk is 20 folds more of the HPV 16. So if a male gets an HPV 16 infection, he has cleared this, he has got 20 times more chance of getting the same infection again. Not only once, twice, n number of times he can get the same infection and again. So he is at a risk of getting HPV infection more number of times, so malignancies will be more common in this species. So 5 important things, very common also in boys. There is no screening test like pap smear in females. Immune suppression is very common. Immune responses are very poor. They are prone to get recurrent infection. So gender neutral vaccine is going to protect not only a male, also indirectly to a female. Just to say that these are few slides from CDC. 4 out of every 10 cases of cancer caused by HPV occur among men. 1. HPV and oropharyngeal cancer, this is the latest study I was reading. In America, whatever is the oropharyngeal malignancies they are isolating, 60 to 70% are they are having association with the HPV virus. And this is the most common cancer in the Western world because they have already prevented by giving HPV. So those who are not immunized, now they are all getting oropharyngeal cancers. This is just to prove my point. In boys, very common with the bisexual female male or a gays, very high incidence. If a person is having HIV, the HPV risk goes 8 times more. So this population are always at the risk of getting HPV infection. So gender neutral vaccination fosters equity of providing males with an opportunity to have direct protection and indirect protection to the females. 5 important points. More cases of head and neck malignancies. There is no test for HPV cancers in male. The odds of getting HPV related cancer increases with the age in boys. The vaccine is just as safe in boys as in girls. Friends, there is no doubt that vaccine must be given to boys as well as the girls if you want to prevent cancers in females, cancers in boys, genital warts in boys and males. So together, if you give me a promise on this promise day that we will vaccinate every individual with the HPV vaccine, we can do a lot. Thank you so much for your patience.
Thank you, Dr. Sanjay, for really giving a wonderful talk. I would reserve my comments on your talk, but we will take questions first. Can I take questions first?
Yes.
Yes? Dr. Uday, you had a question?
Sir, I had.
Thank you, Dr. Sanjay Marathe, giving excellent. I would like to have one question only. Suppose given choice for your own daughter, which HPV vaccine you will choose? Gardasil 4, 3 or Cervix? For your own daughter.
I will always talk a science behind it,
Yeah.
not commercial angle or the cost of the vaccine.
Yeah, that's why I asked.
The cost of the vaccine.
Yeah.
See, two vaccines are same quadrivalent.
Yeah.
Whether it is Gardasil 4 or Cervix, it is same. The Gardasil 9 has got 7 more serotypes. So protection is definitely more.
As compared to
So,
Cervix.
so if I can give Gardasil 9 and I can afford it, I will prefer Gardasil 9 in girls.
Girls, yeah, I'm talking daughter.
Because incremental value of Gardasil 9 in females is to the tune of 15 to 17% as against the quadrivalent vaccine.
Okay.
But incremental values in boys is just 3 to 4%. So in case of boys you are giving, even if you give quadrivalent like a Cervavac or Gardasil 4, it is nearly the same as Gardasil 9. But in girls, definitely, if you are talking about my daughter,
Yeah.
I will prefer Gardasil
Gardasil
9.
9.
But at the same time I am saying,
Yeah, thank you.
if I cannot afford, does not mean that I should not give
How
quadrivalent.
much is the price difference?
Unfortunately, very high.
How much?
Cervavac is available for 2,000 rupees.
Yeah, 1500, yeah.
And Gardasil 9 is 11,000 rupees. And then permission granted initially was 3 doses, but now ECVIP has said across the world we are giving 2 doses.
From
So
9
even
to
2 doses from 9 to
14
14.
only.
So 9 to 14 means 9 years and 14 years and 364 days.
Yeah.
So on 15th birthday, you can start giving 3 doses.
Okay, thank you. You said Gardasil 9, but suppose equal opportunity given between Gardasil 4 and Cervix, which one you will choose? Between two.
I will always go for Cervavac.
Yeah.
It's our own vaccine.
Yeah.
Indian company available for 2,000 rupees against 4,500. There is no question.
As per the HPV recommendation and all the things is absolutely we are following that. But there were some studies by WHO's in a resource limited settings and financial capacity. Single dose may be effective if it doesn't give the 2 or 3 doses. So what is your opinion on that?
Because of the limited time given to me, I did not discuss on single dose. But there are two things, rather two limitations of single dose. They have shown equal protection even by 1 dose in an immunocompetent individuals. Correct. And their aim was to decrease the overall incidence of HPV infection in boys as well as in the girls, so that ultimately it will result into less number of malignancies. So when you introduce in your national immunization program, single dose will work better. But there is no such recommendation that you should give single dose in your individual protection. When patient comes to me, I have to think of the best possible protection. I cannot say you take just 1 dose and forget about it, because there are no studies. No long-term studies are available, like efficacy studies. Second limitation of a single dose vaccination is all the studies are only in females. Whether it is Kenshi study or Indian study, they are all in females. So we do not know what is the response in the boys. So these are the limitations, but I am sure Government of India is going to come out with a single dose in the national immunization program. Like you have seen PCV, they have a different schedule. But when patient comes to my OPD, I have a different schedule as an individual protection.
Thank you, sir.
If a girl is given first dose and second dose is scheduled after 6 months, but she comes after 1 year, what to do? How to reschedule the immunization?
Simple rule. Any patient who has received first dose before the age of 14 years, even if he is coming after 3-4 years later, should be given only one dose and consultation. Because the second dose acts like a booster, and this L1 antigen is highly immunogenic. So protection, as we have said, with one dose is enough. The second dose acts like a booster. So there is no need to revaccinate that individual with the same shot. So just complete the shot. So the rule is that the child should have received one dose before 14 years.
And if the patient has received one dose previously and now parents come that now a 9-valent vaccine has come and we want to immunize with that, so can we do that?
Interchangeability is allowed for the reasons we do not want them not to take the vaccines. But the studies they have done that suppose one patient has received quadrivalent full series and now he has come to you that I heard about a 9-valent and I would like to give it. All the studies are available after 1 year of completing the schedule of a quadrivalent. So recommendation at present they say that if you want to switch over to a nanovalent complete immunization schedule again, you can explain them that the advantage will be of 15 or 17% more of the other serotypes over the quadrivalent. I can give you the same schedule, but now if the child is above 14 years, now you will have to give 3 doses and after 1 year of completion of the quadrivalent. In your case, the child has received 1 dose of quadrivalent, you can complete with the second dose with non-avalent. Telling them that protection against the 4 serotypes will be 100%. With other serotypes, I am not very sure whether it is going to be 100%. But then you can complete the schedule with using the Gardasil.
Sir, your comments. Mutwal sir.
Thank you very much, Sanjay, and thank you very much, AHA, for giving us opportunity. So one thing is very sure that we have to catch them young. Even if we have to give only single dose vaccine, it would be best to be given at the adolescent age, because that is the age in which squamous columnar junction is not mature, so that invasion of the virus and lodging it into the cells is much more than what happens after a few years of age. And I understand that 16 and 18 only do not become gender neutral vaccines, so quadri or 9, anything would be.
This one will be an nanovalent, but then for males the incremental value is very less. You can go ahead with the
And all of you please remember, whether you want to accept or not, the children are sexually active at a very younger age, in which their body, their squamous epithelium and all, they are not mature. So the chances of, in India, chances of HPV invading into cells, causing cancer would be much more. Thank you very much.
Thank you very much. I would like to welcome Dr. Kotwal sir first. I would request Dr. Geeta Patil madam to present a memento to our speaker, Dr. Sanjay Marathe. Thank you very much, Marathe sir.
Many times parents bring a girl and when we tell them we have to give it, so never tell it is for sexually transmitted infection.
That's the rule.
We should tell them it is for a cancer prevention. That has to be remembered because many times they tell us, oh my daughter is getting married after 10-15 years. So why should I give now? So it is not because of that, that is the point, because this was taught to us as I was a trainer for the HPV IAP action plan.
This is the bottom line. Never
The second part of our HPV IAP action plan was this, how to counsel the parents.
Master tell us.
So thank you very much. Thank you Marathe sir for your